Hello everyone, I'm Anas Al-Ubaidi, and the title or the topic for this session or lecture is Advanced Techniques for Writing SOAP or SOAP Notes within the chapter of Review of Medical Scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. SOAP or SOAP notes are a structured method of documentation used by healthcare providers to record patient information. SOAP notes which is short for S for subjective for S, objective for O, assessment for A, and plan for P, are a standardized system for organizing and documenting patient interactions in clinical settings. These notes are the foundation of medical documentation and serve as a critical communication tool among healthcare providers. By using a consistent structure, SOAP notes ensure that all relevant information about a patient's condition is systematically captured, making it easier to assess, plan, and manage care. They streamline collaboration within care teams, enhance the continuity of care, and provide crucial data for legal, billing, and research purposes. For advanced medical scribes, mastering the art of writing detailed yet efficient SOAP or SOAP, again short for subjective objective assessment and plan, notes is essential. Scribes play a vital and essential role in supporting providers by accurately translating patient interactions into actionable records that can be used across specialties. Now, high quality SOAP notes not only reflect the patient's condition and progress, but also ensure compliance with documentation standards. Advanced techniques used in crafting SOAP notes go beyond basic recording and focus on synthesizing complex patient data into an organized and meaningful structure that supports clinical decision making. Objectives. Understand the significance of SOAP notes in healthcare documentation and communication. Learn each component of SOAP notes and how to apply them in clinical practice. Master advanced techniques to refine SOAP note writing for efficiency and precision. Identify and address challenges in maintaining clarity, accuracy, and uniformity. Apply these skills effectively in diverse clinical scenarios. Key points. Main components of SOAP notes. Each section of SOAP notes plays a distinct role in documenting relevant aspects of a patient's condition. A deep understanding of these components is crucial for maintaining accuracy and completeness. We'll start with subjective, as again, SOAP or SOAP stands for subjective, objective, assessment, and plan. So subjective here, the subjective section captures the patient's direct input, including their history, symptoms, and current concerns. This part provides invaluable context for understanding their condition from their own perspective. Focus here reflects the patient's account of their reason for the visit, often includes a direct quote to capture their description of symptoms verbatim. Example, I've been feeling very tired lately and have a dull ache in my lower back that won't go away. The importance here helps narrow down diagnostic possibilities by understanding symptom presentation. Advanced tips use specific prompts to explore key aspects, for example, onset, location, duration, severity, and factors that improve or worsen symptoms. Record relevant history that supports the chief complaint, such as previous visits and addressing similar conditions. Objective for all. The objective section presents factual, measurable findings obtained from the patient encounter. Focus here includes vital signs, results from physical exam or examination, and any test results obtained during the visit. Example, vital signs, blood pressure 130/85, pulse 76 beats per minute. Physical exam findings, mild tenderness in the lumbar region, no visible swelling or redness. The importance here provides concrete data to complete the subjective information for better analysis. Advanced tips here clearly distinguish between symptoms, patient-reported, and signs, clinician-observed findings. So whatever the patient is reporting, it's called symptoms or symptom for a singular. What is observed by the clinician or the provider, or is found by the clinician or the provider, is sign or signs for plural. Ensure all relevant exam findings, even if normal, are documented to establish a complete clinical picture. Stay concise yet descriptive. Avoid inserting extraneous details. And here is a diagram showing the objective section in medical documentation. Assessment for A in SOAP. So the assessment section synthesizes the subjective and objective components, summarizing the clinician's diagnostic impressions. The focus here identifies the problem or problems and lists diagnoses or differential diagnoses, often prioritizing the most critical first. Example: primary diagnosis, chronic lower back pain or chronic low back pain. Differential diagnoses include lumbar strain and disc degeneration. Importance links the observed data to logical conclusions, providing a basis for clinical planning. Advanced tips justify each diagnosis with a brief summary of supporting evidence from the subjective and objective data. For complex cases, divide assessments by problem categories. For example, neurological as one classification or category, and we have musculoskeletal, for instance. P for plan in SOAP. So the plan outlines the next steps for managing the patient's conditions or condition. This section ensures continuity of care by clearly identifying treatment goals and interventions. The focus here includes recommended tests, therapeutic measures, patient education, and follow-up instructions. Example: prescribed ibuprofen for pain management, 200 mg, 3 times daily. Ordered lumbar spine x-ray. Advised patient to return in 2 weeks for reassessment. The importance here provides actionable steps for all parties involved in the patient's care. Advanced tips: be specific, list timeliness or timelines, dosages, and follow-up criteria. Document instructions for patient education and lifestyle modifications clearly. Address unresolved problems and explain why certain actions are deferred if applicable. And here is a diagram showing the patient care plan as a pyramid. The challenges in SOAP note documentation: consistency across providers. So variability in how SOAP notes are written can cause confusion and hinder care coordination. For example, one provider includes detailed physical exam findings, another focuses narrowly on test results. Solution here: use standardized templates tailored to the healthcare setting or specialty. Balancing, another challenge, balancing detail and brevity. SOAP notes must strike the right balance between comprehensiveness and brevity, ensuring key points aren't lost in unnecessary detail. Example: including symptoms unrelated to the presenting complaint by dilute the note's clarity. Solution: focus on information pertinent to the chief complaint, current medical conditions, concerns, and the patient's progression. Another challenge: adapting to specialty variations. Now, certain specialties may emphasize one component of SOAP notes over others. Solution: adapt your approach to reflect the needs of the specialty. For example, in psychiatry, the subjective section is often emphasized, while in surgery, the objective and plan sections take precedence. Here we have the advanced techniques for writing effective SOAP or subnotes. Use smart phrases and templates. EHR systems or EMR systems allow users to create quick access templates. For example, smart phrases for frequently documented conditions. So example, a template for follow-up visits with standardized sections for tracking chronic conditions like hypertension. Another advanced technique: integrate clinical guidelines. Provide evidence-based documentation that adheres to clinical guidelines for consistent quality and compliance. Example, for diabetes management, document HbA1c trends in the objective section and reference guideline-based treatment adjustments in the plan. And here's a diagram on enhancing SOAP notes with EHR tools, electronic health record tools. Another technique, stay problem-oriented. Write SOAP notes focusing on specific issues rather than creating exhaustive narratives. Example, for a patient with multiple issues, categorize each problem separately with its own assessment and plan. Real-time documentation. Whenever possible, complete SOAP notes during or immediately after the encounter to minimize inaccuracies. Tip, use shorthand during encounters, then expand your notes comprehensively once the interaction ends. Another challenge, another technique, advanced technique, regular feedback and peer review. Engage in peer reviews to refine your SOP. Note writing skills over time. Benefit feedback highlights areas for improvement and encourages consistency in high-pressure clinical settings. Examples of clinical application. For chronic disease management, documentation of a diabetic patient's follow-up visit might include blood sugar logs, objective, medication adherence, subjective, and updated insulin dosage plan. Post-surgical recovery, SOP notes for orthopedic surgery follow-ups can track wound healing, pain management, and physical therapy outcomes. Mental health. For therapy progress, the subjective section captures patient emotions while plan details adjustments to medication or counseling frequency. And here is a diagram on medical documentation components. Next, we have summary tables, table on key components of SOAP notes, table on challenges in SOAP note documentation, table on examples of clinical application, table on benefits of using SOAP notes. Here's a table on strategies for effective documentation. Next, we will revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. What is the primary focus of the subjective section in SOAP notes? And subjective are, as we discussed, S for SOAP, S as also in symptoms, so meaning whatever the patient is reporting and their perspective, the patient's perspective. A, documenting laboratory test results. B, recording the patient's perspective, including history and symptoms. C, outlining the treatment plan. Or D, listing the provider's clinical diagnosis. So B would be the answer, as the subjective section captures details from the patient's point of view, such as their complaints and symptoms. Question 2. What type of information is typically recorded in the objective section of SOAP notes? Signs or the findings from the observed findings by the provider or the clinician. So A, the patient's lifestyle habits. B, measurable data like vital signs and test results. C, the provider's differential diagnosis. Or D, the patient's personal opinions. B would be the answer. Measurable data. For instance, vital signs and test results. So the objective section contains factual, observable data such as physical exam findings and lab results. Question 3. Why is consistency a challenge in SOAP note documentation? A, provides use varied templates or non-standardized methods. B, it requires excessive amounts of time. C, patients do not share enough information. Or D, SOAP notes are only useful in mental health settings. A would be the answer, as variations in formatting and not taking practices can lead to inconsistencies. Question 4. What is the purpose of the assessment section for A in SOAP? In SOAP notes, A, to list the patient's vital signs. B, to synthesize subjective and objective data into a diagnosis. C, to record a summary of the patient's symptoms. Or D, to instruct the patient on follow-up steps. B would be the answer, as the assessment combines all gathered information to arrive at a diagnosis or differential diagnosis. Question 5. What is an example of clinical application of SOIP notes? A. Documenting vital signs manual in a notebook. B. Recording a patient's progress in physical therapy. C. Conducting baseline diagnostic testing. Or D. Writing patient care updates in causal or casual language. So, what is an example from the followings as of a clinical application of SOIP notes? And the answer would be here B, as recording a patient's progress in physical therapy. As SOIP notes are widely used for structured documentation of patient progress, such as in therapy sessions, including physical therapy. And here we come to end of this lecture. Thank you very much and goodbye.